Channeled Manner, and I want to hear about you and the issues you care about. Look for me here every week in the press room, live on Searchlight's Facebook page. We ask a question and you give us your take, or you ask a question and we find the people who have the facts. It's time for real people, real stories, and real talk. Every Wednesday at 8 in the press room on Searchlight's Facebook page. Now, let's talk. Good night and welcome to the press room. I am your host, Shannon Monroe. Every Wednesday evening at 8, right here on Searchlight's Facebook page and YouTube channel, we discuss issues of national importance and how they affect the Vincentian public. Thank you for joining us. On 11th March 2020, COVID-19 was declared a global pandemic, bringing everything in the world to a halt. Every industry was impacted, and we are still trying to recover and adapt to the new normal. In St Vincent and the Grenadines, we are in the midst of an upsurge in infections. With business operations and educational institutions being interrupted when staff and students test positive. Other sectors like the events, entertainment, and tourism industries are struggling to regain their footing. On this week's edition of the Press Room, we will discuss the current state of play in relation to COVID-19 in St. Vincent and the Grenadines, how useful are the findings of the UNICEF report on vaccine hesitancy in St. Vincent and the Grenadines, and how can the results of the survey help us to navigate ourselves out of the current spike. Tonight's panel comprises Chief Medical Officer Dr. Simone Kiza Beach, Acting Chief Health Promotion Officer Shanika John, Country Head for AB InBev for Barbados, Dominica, and St. Vincent, Shafia London, and social commentator and historian Dr. Gary Denny. Remember to share the live stream and leave your comments. We'll try to answer them during the program. When we come back, we'll be joined by two of our panelists. Welcome back. We extend a hearty welcome to the press room to Chief Medical Officer Dr. Simone Kiza Beach and Acting Chief Promotion Officer Ms. Shanika John. Good evening, ladies.
Good evening.
Good evening.
Good evening. We're just trying to get a sense of where we are right now in St. Vincent and the Grenadines. This is our third COVID-19 surge that we've experienced since the first case was detected here. How is this one different from the other two?
Okay. Shinka, I'll go ahead.
Yes.
So good evening. As it is now, yes, we're in the third surge. Currently, we have 6,615 cases. Today, we announced 2 more deaths. So we are up to 90 persons having died since 2020 March. And we have currently 873 persons being active. Surge is characterized by the variants which are driving it. So right now we have a lot of Omicron and we still have some Delta. So the sequencing results coming back from CAFA confirming that we have community spread of the Omicron and community spread of the Delta variants. And you know, those are very contagious variants, the Omicron especially. And so we're seeing the classic, what's now classic for Omicron, where we have many persons being infected very easily. A lot of the disease is the mild flu, sore throat, headache, but we are still seeing quite a few persons having significant disease. So the main characteristics of this surge will be typical to the Omicron, but also with Delta hanging in there. So rapid spread, rapid increase in figures coming out of December 26 into still going strong right now. And the type of cases we are seeing, a classic for the Omicron in the unvaccinated persons and in the vaccinated persons.
Okay, now with this surge, how is the health system holding up? Are we seeing more admission to hospital?
Jan? Okay, so yes. Yeah, Shanika?
Go ahead, Dr. Giza.
All right. In terms of admissions, definitely we are seeing increased admissions. So right now we are up to 28 persons at the Milton K. Memorial Hospital. And you know, a few weeks ago, we were all the way down to 16, 14 cases. So we are seeing a significant increase in the number of admissions. And if we are admitting persons, that must mean that they are ill enough to be in hospital. It's also affecting in terms of our capacity to give care. So it is definitely a challenge now, because despite being fully vaccinated in terms of our staff, we are seeing some staff members being impacted by COVID and having to go off on leave. Thankfully, because they're vaccinated, we are not seeing those persons being very ill, and most of them have been able to recover in a matter of the 5 days to 7 day period and to get back on the job. But it's definitely having an impact. And if we think about it, if we didn't have these persons being fully vaccinated, we might have been in a much worse situation right now.
Of the admissions, can you give us a breakdown of how many are vaccinated and how many are unvaccinated?
Mika? Go ahead.
From today's report, I think the latest report indicates the number is still significantly higher in those persons who are unvaccinated. So we're still seeing that, but we still have quite a few persons who are vaccinated in there as well. I don't want to give the exact numbers because the figures change very often. So we're still seeing persons who are unvaccinated and vaccinated, but with a greater range in those persons who are unvaccinated.
Okay. Now, as Dr. Keyser said, the Omicron variant is more transmissible than the other variants, and the symptoms are similar to that of a regular flu. Many persons seem to think that this variant as a milder version of COVID-19, and some even want to contract it to get it over with in order to build immunity. Is this a good idea?
It's definitely not. The Omicron variant is still, the data that is coming out is suggesting that it does have mild symptoms, especially in those persons who are vaccinated, which is what we are seeing a lot in St. Vincent at the time. Those persons who are vaccinated, they're coming down with the muscle pain, the sore throat, which seems to be recovering in a much shorter time. But thinking and being exposed to this particular variant and hoping that it will bring some sort of immunity is still a very far-fetched idea. There's no data that is suggesting that is possible as well. And so we still ask persons, even if you are vaccinated and unvaccinated, to take all the precautionary measures, especially because this is a very infectious variant that we're dealing with at this time.
Right. And also, as we just said, we have Omicron and Delta. How do you know which one you are going to get?
Exactly,
right?
exactly.
I mean, you're gonna what? You're gonna say, okay, come Omicron and you Delta, you stay away from me.
Yeah.
So you're likely to, you don't know what you're dealing with there, where you're going to expose yourself willingly, knowingly, and hope to get this, because you can end up with long COVID still. And we know now the research is so much, building about the impact on diabetics. And going into this, we had a epidemic of non-communicable diseases. A large proportion of Vincentians are diabetic or pre-diabetic, a family history of diabetes, and it's been shown now that the COVID increases if you're diabetic, it makes it worse. And if you are pre-diabetic or you have a tendency to be, it can often tilt you over into the diabetes. So I think the whole idea of, let me just get it over and done with is not a very good idea at all. You don't know what you'll be done with at the end of it.
Extremely risky.
Now, there have been reports of persons being turned away from district clinics when they go for COVID-19 testing. What is the protocol if you suspect you were exposed or think you may have COVID-19?
So I can start. For that particular area, we recently revised our quarantine, testing, and isolation protocol for those persons in country. We adopted the specific measures from CDC as well. Whereas for those persons, if you are a known contact of a positive, which means you were in direct contact with someone without a mask for more than 15 minutes, or you may live with someone who have tested positive, you may fall in two different areas. One is vaccinated and the other is unvaccinated. If you are classified to be vaccinated, we ask you to continue for 5 days. If you develop symptoms before that, then we ask you to seek care. And then in the care, there may be assessment that's being done. So it's a clinical diagnosis, or in some instances, they may offer you a test. I think one of the biggest challenge with persons getting the idea of that they're being turned away from the health facility is that people are still feeling and wanting the need to be tested. So if you call me today and you say, I've been tested for COVID and I was with you today, I automatically rush to the flu clinic to get tested. And then sometimes even later in the infection, when persons may be classified or categorized as being clinically diagnosed, they still want to get tested. And I said to the team as well that, it's partially on us, because we did said earlier in the pandemic that if you are experiencing flu-like symptoms, etc., that you need to go and get tested and seek care. Mm-hmm. But at this point in the pandemic, things are rapidly changing. And so this is part of the reason why our testing protocol has changed as well. Dr. Kiza?
Yeah, no, that's definitely it. So, and I think also some persons, according to their workplace or some schools actually are telling persons that, okay, you had COVID, but in order for you to come back to work or to school, you need to have a test. Mm-hmm. But our protocol, as Shanika said, is guided by CDC, is guided by WHO. And it says that there is no requirement, especially when you're in the height of a surge. And so your testing capacities must be, they're being strained. And so you have to prioritize so that in our system, in the public system, we have said that we're not going to be testing the routinely to clear you anymore. And if you need to get that, you need to go to seek care elsewhere in the private sector. So I think that is contributing to, as what, in addition to what Shanika said, is that she said the clearing out and the demands by the employer or by the schools to have that test that says you're clear. And we also know too about the challenges with tests, and a test that might show, depending on the test, might show positive, and you're not actually infectious anymore. So the push now to is that you don't need to have this clearance test. We are going more towards the timing. You have no symptoms, no fever, you're fine.
Yes, and I think that is important to note with the revision of the protocol, because it's not a case where you isolate for 5 days if you are vaccinated, you isolate for 10 days if you're unvaccinated, and then you can go. The protocol actually says if you have no symptoms. So we know of persons who maybe after the 5 days may have 1 or 2 symptoms and they may need an additional 2 days. There are provisions in the protocol that would allow you to have that particular coverage. But we're also seeing that persons will test positive and within a 2 to 3 day, they're back to normal, especially more so in the vaccinated group as well. They're back to full capacity, like nothing ever happened. And I think all of that is part of the reason why more persons are saying, well, let me just get this variant and be over and done with. But again, that's also very risky there to go with.
Yes.
Right.
Of the people who tested positive for COVID in the last month or so, how many were fully vaccinated?
Okay, so we looked at those figures over the last few weeks, and between the 29th of December and the 11th of January, we had about 400 or so cases, a little more than that, 400 to 600 cases. But the vaccinated numbers for the PCR testing would have been 250 something, with a working out a percentage of 44%. So 44% of the PCR positive persons in that 2-week period coming out of Christmas and into the first week or so of January, so 15-day period, we had 44% of the PCR positive persons being vaccinated. That's a lot.
Yes.
We also need to consider, however, that for January alone, I think it was, we had about 700 antigen positive cases, okay? So that 44% does not take into consideration those 700 plus cases. But we definitely are seeing a larger number of our cases being vaccinated persons. And this, again, is typical of the Omicron, and the fact that the Omicron has been found to be more capable of affecting persons who are vaccinated, especially if they've been vaccinated more than 5 months ago and have not received their booster. So
Okay.
that, we're urging persons to get your booster. But that's the picture. It's typical of what is being seen elsewhere.
Okay, now someone who is not vaccinated and hears those figures would ask, now, why is it still recommended that people get vaccinated?
So there, from the onset, we said that even if you take the COVID-19 vaccine, it's not going to stop you from getting the infection. We've made that very clear. But what we are seeing now is that those persons who are vaccinated and they're becoming infected with the Omicron variant, not just in St. Vincent, but around, is that their severity of the disease is much mild or sometimes non-existent. And two, their chances of hospitalization and death is significantly reduced. And I think part of this is the buzz around the globe now of countries wanting to know whether or not what they should do and how they should proceed forward. And that's simply because the measures that were put in place before, especially where vaccination is concerned, a lot of them are reaping the benefits of that right now. So even though you may think that, well, I can catch COVID anyway, but the severity and what happens after is something very important for you to consider as well. Because as Dr. Keyser would have mentioned, we've had significant increase in number of persons who are vaccinated being infected. But
yes,
in terms of hospitalization and death, it's still significantly lower in the vaccinated than it is in unvaccinated.
Right. And then also we look at, because like, for example, today we have 28 persons on the ward. We have 20 of them being unvaccinated.
Okay.
But we also have 2 pregnant persons on the ward. And we have 1 child under the age of 15. All right.
okay,
We are already seeing more admissions in children. And we are seeing more ill children. Okay, so we have to be very careful about that, because when you get vaccinated, as we always say, you're not getting vaccinated just to protect yourself. You're getting vaccinated to protect everybody else around you. And we really need to get vaccinated to protect our children and produce the vaccine cocoon as much as possible to protect those others, right?
yeah. Now, you just spoke of children. We are hearing reports of outbreaks of COVID-19 in schools, and a few schools have gone back to the blended approach. Was it a good idea to reopen schools in the midst of this spike in cases? And are face-to-face classes driving the current surge in cases since the children take COVID-19 home to their parents?
Okay, so I will push back on that, Shan. We have been looking at the figures in terms of children, in terms of the surges and what proportion of the persons infected, which age group. And in the previous surge, and the numbers were more towards the children. Okay, we were seeing that those unvaccinated, again, the children were the ones who were really leading that previous surge. It's not the same this time. Okay, the numbers, the greatest the numbers in the age group with the greatest impact right now is that active, those 18 and up, those people up and about, those people who are out enjoying Christmas and New Year's. Those are the persons. So rather, the pattern seems more to be the child gets it from the unvaccinated adult outside the school, takes it into the school, and then spreads it. So that the whole idea that, okay, we should not have allowed the children to go into that safe environment, that's safer, because right now the schools are actually much safer than that van with all of those unvaccinated persons and those homes, unfortunately, where you have unvaccinated persons. All right. But from the beginning, the advice to the schools throughout this, we have said that depending on the school, depending on the level of disease within the school, depending on the capacity to space, each school would come up with their particular formula to allow for as much as possible face-to-face, because the evidence is overwhelming now that the damage to children in terms of not having them in school is much greater than if we, when we lock them away, you lock them in there and then they have to come back out, right? So what we should be doing is making sure that when they come out, that out is safe. And when they go home, that home is safe. All right.
Miss John, would you like to add anything?
No, that's good. That's good.
Okay. Now, the most recent protocols for mass events stated that a vaccine, a booster, and a negative rapid test are required to attend the party. But why are we still asking that persons attending approved parties be vaccinated, saying that you are also now required to produce proof of a negative rapid antigen test before you are allowed entry?
Okay, so I can start for that area. So based on the information that we're getting out of the UK and so forth, from studies that have been done, for those persons who have been vaccinated for 5 to 6 months or so, we're actually required now on this particular point to get a booster shot. And so that booster that we have, because I know a lot of persons have been asking whether it's the Pfizer booster, but we're using Pfizer as a booster and AstraZeneca as a booster and Sputnik V as a booster. So that is just for you to understand there. So once you've been vaccinated, 5 to 6 months there, you're eligible for a booster and you should get that particular shot. That also reduces your chance of transmission, reduces hospitalization, reduces significant deaths as well. So for those persons who are going to gather within that specific space and that specific environment, it is important for them to have sufficient coverage. And that coverage would also help to slow any possible transmission of the virus from point A to point B to C and so forth. And that was our aim behind adding the booster. The negative antigen test, though, is because what we did learn from last year as well, and even from previous activities, whether private or public, is that people tend to go into activities sometimes not knowing that they're sick or knowingly know that they're sick. And so this is also an additional buffer for those persons who are going to be in that very environment for a prolonged period of time. And we know when we go to these parties, private and public events, we're not wearing a mask, we're not keeping our distance, because the vibes is nice and really want to enjoy a good time. So this in itself offers you the opportunity to do that, to have some sort of comfort in knowing that the people that you are interacting with within this particular space for a prolonged period of time have sufficient coverage where vaccination is concerned, and they would have at least received a negative antigen test within 24-hour period. Dr. Kiza?
Yeah, so that's basically it. And we have to learn from, our experiences. So our experience taught us when we had the vaccinated events in the summer, we were not dealing with Omicron. We were dealing with other variants, which did not cause this level of infection in fully vaccinated persons. This is where we are now, however, where we have a variant which is causing infections in vaccinated persons. And so we need to deal with that. So that's the reality. And so we need to put measures in place. This is hopefully going to be a much more temporary measure, and we'll be able to get back to just the persons being vaccinated and not having to do the test, because we understand the test is difficult. But the idea is that once you have sufficient coverage within the community and we have reduced the level of spread, where we're not getting 44% positivity and those kind of figures right now. So once you have done that and your level of disease spread is much less, then we can say, okay, let's hold on the testing and just make sure the persons are fully vaccinated and boosted appropriately.
Mm-hmm. And this is in no way indicating that because persons are assuming and are joining the conversation by saying that the vaccinated events or the vaccinated activities are responsible for the spike. That's not the case. The entire season, the entire festive season would have been contributing towards it, because we all would have had whether private family functions that led us into these public functions, that led us into these public spaces and public gatherings. So it was entirely a ripple effect. But for us, from our standpoint, the Ministry of Health, the Health Services Subcommittee, we're going to put measures in place to ensure that even going forward, we can improve. And so this is one of the measures there. So we're still working with those in law enforcement, especially to ensure that those unauthorized activities and events are also following the specific protocols and go through the specific requirements. So this is in no way targeting those persons who are following through with vaccinated events, but it's just a method in which we could streamline everything.
Okay, now we are seeing long lines at private labs for COVID-19 testing. Why was exit screening discontinued at the government molecular laboratory?
Let me take that. All right, so exit screening is actually, I would like to call it a misnomer, right? I mean, we call it that, but we shouldn't have. Because when you take a test to travel, who determines what test you take? The country you're going to. So the test is not really for us. The test is for the country you're going to, right? Granted, we do pick up information when some people test positive, but you are going somewhere else. So this test to travel to another country is not of the local public health concern, in terms of it is not a public health related test, all right? So when we come to a stage where we have a lot of tests to do and we have to prioritize testing, we must keep that testing for the sick people, the vulnerable persons, for the testing that's going to drive our work in terms of give us information of what we're doing. So exit screening is not screening for us, it is entry screening for where you're going to. So that's why we, even before this, when we cut back completely now, remember in October, we had cut back before, because these tests for persons traveling, going on their vacations and so on, those were taking up the majority of our resources. And also because of the deadlines for traveling, and so persons were getting very aggressive and it was no longer safe for our staff also. All right, so we had cut back in October, and because of the spike and the increased demand in terms of the resources and the need for us to prioritize how we use our resources, we decided to end that. And there's sufficient private labs now that have been validated by the Ministry of Health. There's sufficient private labs out there to take that burden off of us. And also because a lot of these countries are not doing PCRs anymore. So England doesn't require any tests at all to leave St. Vincent to go there. You test when you get there. The US requires an antigen if you're going directly. Most of the PCRs come from Canada, and we know Canada has, I think their last flight might be next Monday. And the if you're going to Barbados or Trinidad, some of the regional areas, those are the ones who would have a PCR. So that's basically why we did that. Exit screening is not a screening for us.
Entry screening. The COVID-19 vaccination dashboard says to date we have administered more than 50,000 vaccines. However, the number of persons getting a second dose seems not to be keeping up with the first. Why do you think this is so?
There are multiple factors to consider. We are continuously encouraging persons to get their first and to complete their second dose. I think last year in particular, we hit hard trying to close the gap in terms of those persons who need to get their second dose. People are generally a bit hesitant when it comes to their second dose, maybe for multiple reasons. They did it in the first instance and then they switch out their minds and so forth. And so we will continue to approach those persons. I think there's a lot of personal factors to consider for people not coming back for their second dose. For some persons, they would have taken their first dose and traveled, making it easier for them to connect when they get there as a start as well. And so that is also locked in our system. So there are multiple factors, but we are definitely trying our best to see how much we could close that gap for persons.
Okay. Now, how many people have taken the booster shot? And should your booster be the same type of vaccine as your first two doses? What is the recommendation?
So we have roughly about 1,800 persons who have taken their booster shot. In terms of persons who are eligible for a booster, we have more than 15,000 persons who are eligible to take their booster shot. And we're hoping that if they have not done so as yet, they will consider doing so soon. The evidence suggests that you should boost with a different vaccine. So for example, if you've taken Sputnik V, we would recommend that you boost with a Pfizer, although some persons prefer to stick with their vaccine that they started with, just to get more or less, like a lack of a better word, a tap up. So you just get a little tap up. So if you take Sputnik 1 and 2, you probably will go back with a Sputnik Light. But we would recommend that you take a Pfizer to give you that sort of increased efficacy and effectiveness. No medical degree here, so Dr. Kiza.
No, well, Shan, that is what you are. You are the Chief Health Promotion Officer. So you have the information, and she's right. The whole idea about the switching is that the evidence is there that, if you switch the modality, because the Pfizer is the mRNA vaccine type, and then the Sputnik and the AstraZeneca are the vector vaccine, viral vector disease, vaccines. And so if you switch the modality, you get a very good response. However, of course, there'll be some persons who had to take the Pfizer because they might have had some predisposition for clotting, and so Pfizer was recommended compared with the AstraZeneca. Or some persons might have taken AstraZeneca because they have had a bad history of allergies, and with the Pfizer, the whole anaphylaxis risk. So that for each individual, it might be that you stick with what you took before because that was what was recommended specifically, or if not, you could do the switch and take both modalities so that you have that increased response. But any booster is better than none at this point.
Have there been any adverse or serious reaction from the vaccine in SVG, and has anyone died here from taking the vaccine?
Okay, so we have had adverse reactions as other countries. We have a system here where we have a very strong pharmacovigilance unit in the region, really, really strong. And that's a unit that reports on any adverse reactions to any drugs that persons might take. So with the vaccine, we also have been reporting persons who might have had, a very bad period of a headache. Some persons have had a rash. Some persons have had the lymph nodes swell under the arms and the neck. Some persons have had prolonged pain in the arms. There are some persons who, at least two persons who have had excessive responses in terms of they had an autoimmune disease. And so then they had a flare up of that, okay, after the vaccine and then settled. In terms of deaths, I know there have been many, many reports of persons dying from the vaccine. We have had none of that until recently. There is one case of one person who received the vaccine in May of last year and developed some condition, some symptoms developed about 2 or so months after the vaccine. And we were investigating that case, and that person sadly died. And we are continuing our investigations. We are going to continue those investigations, refer the matter to PAHO for their input. And once we have any sort of evidence, reports, final, we will let persons know about that. Okay.
Now, are we optimistic that we will soon see an end to this pandemic?
I pray.
Nika is the optimist. Pessimist here.
Yeah, I'm praying soon. I'm hoping that we would see it's an end, but I remember very early in the pandemic, Dr. Keys said we have to learn to live well with it. And so I think if anything, I think as Vince mentioned, we need to have our existing resources, have what is available to us, and how can we use that during this pandemic to live well with it and make sure that people are still healthy, people are covered, access to the services that they need, etc.
Yeah, I think it's a matter of us learning from this and moving into a better place, a healthier place. Sometimes when we think about what we did before in terms of not washing your hands as you should, or in terms of sharing some sort of, whether it's a cup or something, just different practices, different things we did. Bundling up in an elevator or in a room, room closed and people coughing all over the place. So maybe we come out of this in being a lot more aware of healthy living. Also, we come out of it being a lot more conscious of the mental health challenges that illness brings to others, because we are now all aware of the stresses of what happens in quarantine, what happens when persons get so anxious about being infected, or if somebody gets sick, what's going to happen to them. So I think we have to learn from this and build from this. And some people say, oh, we want to go back to where we were before. I don't think we want to do that. I think we need to move forward to a better place. Evidence is saying that, this coronavirus is not probably going to go anywhere, but maybe how it's manifested and how we function in terms of being careful, wearing your mask when necessary, being aware that you might have little bumps along the way, and then we get through it like that. We got to work this thing out and move forward.
Yes, that is so true. Well, thank you, Dr. Keys and Miss John. We'll take a break, and when we return, we'll speak about the recent UNICEF survey on vaccine hesitancy in the Caribbean and the Our Best Shot campaign, and how best can we go forward.
Searchlight Online, now stronger and better, and with more options for everyone. Download the free app and access the e-paper and breaking news. Check out our e-papers read aloud and translation features. Read our e-paper in different formats, even when you are offline. Access our online archive as far back as 2005. Only interested in viewing ads? Go directly to our print ad marketplace. Subscribers get exclusive access to a full color midweek e-paper edition, in addition to the weekend edition. Affordable monthly, quarterly, biannual, and annual e-subscription plans. Book, submit, and pay for advertisements online. Go to www.searchlight.vc for more details. Searchlight, journalism you can trust. Now stronger, better, and with more options for everyone.
Welcome back. Welcome to the press room. Country head for AB InBev for Barbados, Dominica, and St Vincent, Ms. Shafia London, and the social commentator and historian, Dr. Gary Denny. UNICEF recently released the findings of a survey on vaccine hesitancy conducted in 6 countries in the Caribbean. There were some interesting findings, including that St. Vincent and the Grenadines has the greatest level of vaccine hesitancy among the countries surveyed. Dr. Denny, you read the report and you have been following developments around the world and in St. Vincent and the Grenadines since the onset of COVID-19. What is your main takeaway from the report? And can you give us your analysis of the findings of the report?
The main takeaway that I have is the great mistrust that we see among, too many Vincentians. And they cover several, elements. We have mistrust of, doctors. We have mistrust of the government. We have mistrust of the, of the long-term consequences of the vaccine. We have mistrust of the speed at which the vaccine had been produced. So they all coagulate into, it seems to be the same phenomena, mistrust. And though they might, for the purposes of the report, disentangle them into these, government, doctors, the long-term consequences. At the heart of this still remains a distrust of the vaccine, and so that being the case, the report is absolutely correct in that regard. What the report doesn't do, and I suppose that was its charge, is to explain why we have this mistrust. But I think a great number of Vincentians know why this mistrust exists, and that mistrust was in many ways quite. It was, deliberately engendered by certain elements within the society and beyond St. Vincent as well. So in that sense, to combat the mistrust, you have to actually combat the forces which are feeding the mistrust. And in that particular element, the report was silent.
Based on the findings and your general observation on the progression of the pandemic, how do we safely emerge from this in the shortest possible time?
Oh, that answer is very, very easy. You emerge from the pandemic in the shortest possible time through mass vaccination. There's no other way if you're looking for speed. And in the longer term, and I suppose given the specifics of not just St. Vincent, but the broader global community, you emerge from the pandemic through the mixture of vaccination and therapies. And we now have, some, pretty effective drugs. Pfizer has a drug which has 89% efficacy if it's taken within the first 5 days or so, which means that we need effective testing so that people can know that they are ill and that they can have access to these drugs. The World Health Organization, made a comment today that we can end this epidemic, this pandemic, pretty quickly if we have from the rich countries the distribution of these vaccines all over the world and the drugs all over the world. Now, that's not going to happen at the speed that is desired, and it still doesn't deal with the issue of vaccine hesitancy. It seems to me that in the St. Vincent constitutes, I suppose, a small arena, a very small arena within the broader global pandemic. Okay, and if we have, across the world, mass vaccination and effective therapies, at some point, St. Vincent would be pulled within that gravitational strength, moving towards vaccination and effective, therapies. So I suspect that we're looking at probably a year, perhaps 2 years before we're out of this pandemic.
Thank you very much. Miss London, can you tell us about the Our Best Shot campaign? Who are the persons involved and why was it felt that this was needed?
Okay, good night, everyone. So in early September, thereabout, a group consisting of persons in the entertainment industry, such as DJs, promoters, sound system owners, photographers, graphic designers, bartenders, radio stations, etc., we got together and we used social media to form a group. And part of the reason for forming the group is that we recognize that one of the hardest hit industries by the COVID-19 impact was actually the entertainment industry, where a number of persons saw that their income streams had declined significantly, in some cases dried up completely. We also recognize that for a country like St. Vincent and the Grenadines, and as a matter of fact, for all countries, every individual has a collective responsibility to help its country, help his or her country, sorry. And so we decided we wanted to be a part of the fight against COVID-19 so that we could get the country back to a state of normalcy. And obviously, for us, it was not just about the economic impact, but also the impact on our lives, our social lives, our families, our children. And we recognize that public health should be a priority and a concern for all. So this group of stakeholders, we got together and we decided to run a campaign. We approached the Ministry of Health and they approved, they endorsed the campaign and they supported it. We decided that we will develop creative elements of the campaign and we would support the elements that the ministry already had to see how much we could convince persons to get involved in fighting COVID-19, particularly through vaccination. We were able, I believe, to create, as they say in the entertainment industry, a buzz and a hype. And we did make a tremendous effort and we are satisfied with the outcome. And it ran just over 7 weeks. And we were able to do things such as social media videos from influencers, infomercials. We were able to have weekly community vaccine pop-ups where we would travel to the communities with the influencers, encouraging persons to become vaccinated. We distributed T-shirts to a number of persons. We had jingles. We had drops on the radios where you would hear a familiar voice, such as a DJ or a songwriter talking to you about the reasons why you should become vaccinated. We had we advertised in popular newspapers online. We also used, in St. Vincent, there's this van culture. We had a lot of the van drivers on board with us. They themselves became vaccinated directly because of our influence, and they in turn worked with us to influence others to become vaccinated. And then in the late half of the year, we also had we executed a number of events to encourage persons to become vaccinated. And we worked with the ministry to ensure that persons who attended those events would have been vaccinated prior to attending. So it was a very holistic campaign. We we recognized first, as I mentioned, that we needed to become involved. So the first thing we did, however, is we did our own research. So we sent out our survey via social media asking people what were the reasons why you were not becoming vaccinated. We surveyed just over 300 people. And we found 5 reasons, and it goes to what the good doctor just mentioned. It was lack of trust, but at least we were able to find out what the trust was about. So one person said that they felt that it was forced upon them. Second, persons felt that there were bad side effects. Third, they felt that they could become sick anyway. So what's the point? Fourth, they felt that they need to know what was in the vaccine. And five, they thought that the vaccine was dangerous. So our campaign messages were built around addressing these 5 reasons in hopes of convincing persons that it is safe, convincing them that the side effects are minimal, if any, and the likelihood of you having a side effect is nil to none. And as Dr. Kiza said, there's been one case that they could probably pinpoint to the vaccine, and we've had over 50,000 vaccines administered. So that in and of itself, the statistics of that should help to boost confidence. And also we explain how the vaccine worked, what was in it, and why the vaccine was safe.
Now, the recent study by UNICEF recommended that in St. Vincent and the Grenadines, in respect of younger and unemployed persons, consideration should be given to promoting infotainment products that might reach this audience, and that non-governmental personalities and influencers should be used to communicate vaccination messages. Your campaign was implemented months ahead of the writing of the UNICEF report, and you took the very approach they recommended. How successful was the campaign? What targets did you have? Because you said you met your targets. What targets did you have, and how did you achieve them? And how many people were vaccinated as a direct result of this campaign?
Well, I was really pleased to actually see that study because we had done our own preliminary assessments, as we said. And also, we know that St. Vincent has a high number of young people. And so we recognize that young people are often influenced by the people around them. So, and we a lot of persons in our group, they were very popular. So we were able to leverage their popularity to, one, maintain trust, and two, to allay the fears about the vaccine. Further, having persons who are easily relatable, persons who they can trust, would open up the path for better and easier dialogue so that you can transmit information and respond to people's concerns and fears. And so UNICEF said it, but we saw it very early that the young people, the persons who are involved in the entertainment industry, that they listen to them, and businesses recognize this, for example, and you would find businesses would engage the services of these said people to get their messages across. And so the same approach should work for us. In terms of what we wanted to deliver, we were obviously working to get the vaccination rates increased to a significant percentage in that target audience. We were mainly targeting that same young group, so persons under 40, 18 to persons 18 to 40. We are looking at those who are hesitant and not that they are resistant. So our resist the skeptics and those who are adamant were our secondary targets, but the primary targets would have been that male and female adults 18 to 40 who were hesitant and who perhaps didn't have the right information. So we targeted that group specifically. In terms of results, we can't take credit, of course, because it's a lot of different messages, a lot of different activities. Shanika and her team, they've been working for months. They've been executing a number of communication pieces. They would have influenced strongly any vaccination rates, but we felt as though having a group like us involved would boost that. So as I mentioned, we started around October. The conversation started in September. in that period, we were seeing like a 10% growth in September. From the start of September to the end of September, there was a 10% growth in the vaccination rate. When we got involved, we saw a jump to the 24% growth. Now, as I said, we can't take full credit for that. We can't say this is a direct, that there's a direct correlation between what we did and the growth, but at the same time, we must recognize that there was a double jump. And we ended just about November. Now, there was a spike, an abnormal spike, if you look at the vaccination trend that occurred around the beginning of November. And that was just about the time when government announced that the frontline workers, particularly teachers, needed to become vaccinated as of November 19th. So you saw a significant spike at the beginning of November up to that November 19th period. But in the period that we were active, we saw a percentage jump of just about 14 percentage points. So we are confident that us participating would have contributed to that, and us participating would have led to some influence. So whilst we may not be able to say 5,000 people became vaccinated as a result of our work, we certainly have stats to show that, for example, on Facebook, what we put out, we reached over 35,000 people in that 7-week period. The radio ads that we had over 700 ad spots. And if you calculate the average listenership for each ad spot on those stations that we used, and we used the station primarily that target out the primary target that we had, it would work out to about 35 million times that there was an audio impression, meaning that it was heard that many times. And obviously in marketing, you would say that after hearing something, it either annoys you to do it or it annoys you to, it convinces you to do it. Either way, you're going to do it. So we were able to create millions of impressions from our radio ads. On WhatsApp, for example, which is a very influential channel, we had these pieces that we would load on our status. And in this group, it's over 100 of us. So just imagine any given day, if 100 of us posted, now that didn't occur all the time, but let's say 50 of us posted, and each person would have on average 500 to 1,000 persons in their contact list seeing those pieces. We calculated that there were over 272 visual impressions on WhatsApp. And then last but not least, and certainly the most direct measurement of our actions, were from the 5 caravans that we conducted, where in those 5 caravans, we had just about 500 persons getting vaccinated during the caravans. Again, and on the caravan, we might not have been able to convince someone to get vaccinated, but you have DJs, you have entertainers, you have influential people on the caravan who were able to have that one-on-one conversation with people and help them to change their minds or to understand how the vaccines work. And so that direct conversation could have ultimately led to that person becoming vaccinated. So we are really pleased with what we did. It was a short campaign relatively. The Ministry of Health, as I said, they've been running campaigns for almost 2 years, and they've been doing a great job. So what we were doing was just boosting that. And we are pleased that an independent international organization has endorsed the approach that we took was perhaps one of the best ways to get that message across. Would we want to do it again? It was a lot of work, and most of the persons involved, they have other employment or they're otherwise engaged. So it was challenging, but we would do it again if we had to, but it's also very expensive. And that's something people need to recognize, that getting the message across is an expensive venture. And so you want to do a lot of things, or persons may criticize and say, you're not hearing this, you're not seeing this, but it's expensive. And so we believe that the one-on-one conversations should continue, and those who are vaccinated should now become the ambassadors of vaccines, especially after the spike. I was listening into the conversation that there's a spike just coming out of Christmas. And based on what Ms. John and Dr. Keyser said, you're seeing persons who are vaccinated getting infected, but they're not getting ill. They're not getting severely ill. And so you can stand up as a vaccinated person and say, I have gotten impacted by COVID-19, but I've withstood it. I only had a little cough, or, so the vaccine is working. Believe it or not, right now, as I'm talking to you, I have COVID-19. And I'm talking to you normal. I don't feel ill. I don't feel any different. And when I spoke with someone recently and they said, well, that means the vaccine didn't work. And I had to correct them. I said, no, it means the vaccine worked, because from the beginning, from the onset, we were told, and science says you can get infected with COVID-19 regardless of your vaccination status, because vaccine is not a preventative method. It's not going to prevent you from getting COVID. What it's going to do is reduce the severity of the impact that COVID will have on you. And I'm an ambassador of that. So before I believed in the vaccine, I'm even strongly more convinced that the vaccines work, because I feel normal. As a matter of fact, my team is like, why are you even home? You should just come to work, because we feel like you're more busy, you're more active, you're harassing us more than when you're home on sick leave. So I think persons who are vaccinated should become ambassadors of it. It's really our only way to get out of this, and to get out fast, because you want to make sure that you're not putting strain on the healthcare system. You want to make sure that we could socialize again. We could meet with Christmas was a little piece of it, and it was so nice. We want to get that every time. We don't want letters coming from the ministry every time we socialize. We want it to be a case that we could go back to normalcy with each other.
Now, during your campaign, I believe you would have had a bit of interaction with the entertainment stakeholders, who have been among the main casualties of the pandemic, as you said. How do you think we can safely go forward in relation to entertainment?
You say a bit, Shanika will tell you. I think I was the mother hen of the group. Because, you persons, when you're impacted, I saw a quote earlier today and I quite liked it. It said, when one door closes, another door opens. But we often look so long and so regretfully upon the closed door that we do not see the one which is opened for us. So because they were so severely affected, you have persons feeling quite depressed, quite downtrodden, that, their lives have changed, because you're talking about a man or a woman's livelihood. So persons there was the motivation, but there was also that layer of feeling down and beaten. So we had to motivate first. We had to come up with a plan, and we had to decide we need to be part of this conversation. We need to influence persons so that we can get back there. So would we do it again? Yes. But do we think that it has worked? Yes. But it needs each individual recognizing that this is not about you, the individual. It's a collective thing. And there needs to be more of us. So there's 100 of us in this group. We need another 100. We need other people to come on board and recognize it's only together that we can move forward.
Okay, thank you very much. We will take a break, and when we come back, we will have a general discussion during which we will try to answer some of the questions, some of the many questions in the comment section. Welcome back. Well, during the program, we had quite a lot of questions, and we're going to try to get them answered right now. We have a question here that's asked, how do you guys feel being the promoters of the vaccine, only to hear that this country is the most vaccine hesitant? Do you feel like you didn't do a good job? I am guessing that question is for Miss London.
Sure. So I guess part of it is for me because, as I said, our campaign was only 7 weeks long, but the Ministry of Health would have been involved for an extended period. At the end of the day, I think Dr. Denny said it. St. Vincent is vaccine hesitant because of there are some issues that drove that to where the levels that it's at. And unfortunately for us as a small society, disinformation, not misinformation, which disinformation is a deliberate effort to share false information. Unfortunately, that took leg really fast and it grew from legs to wings really fast. And unfortunately, as well, we have a society, and even that same research spoke to it, where hearsay or your social network is your primary source of information. And it means, therefore, that we are listening to bad information and spreading bad information. And so the penetration barrier for good information it's already been established. It has grown really thick and it's hard to penetrate that. We have tried. I think we've made progress. As I mentioned, as a country, we should be proud that when we look at the stats, from September, we had just about 32,000 vaccinations, and we moved to just about over 50,000 in December. So in 4 months, we doubled the vaccination rate in months. But as I mentioned before that, you already had that hesitancy level that was increasingly strong, very resistant, and you have to break it. There becomes a point when we will break through. I'm convinced we will break through. But there is another factor that is happening in St. Vincent and the Grenadines, and I observed it with my own two eyes. And I suspect is one of the reasons why that hesitancy is probably going to last longer than we would like, is that enough persons' lives have not been affected directly by COVID-19. And I say that to mean that in other countries, I reside in Barbados, we had months where you couldn't leave your yard, for example. You couldn't go outside and exercise. You couldn't go to the beach. You couldn't do anything. Right now, there, except tonight, because it's election. But right now, there is a curfew at midnight that you can't go anywhere from midnight to 5 a.m. You had restaurants having to cut their capacity by 50%. And you had tourism, which is the main income earner for this country, Barbados, that is, impacted significantly where hotels had closed down. So thousands of people were out of work. Thousands of businesses were affected. St. Vincent and the Grenadines has been very lucky. When we say we are blessed, I believe that so firmly. We've been so lucky because we didn't have to do those things, and the outcomes are very similar. But the downside of that is because people were not impacted directly, they no longer have that extra motivation to protect themselves and to protect others because their lives have not changed significantly. So I believe that because of that, the resistance level for St. Vincent and the Grenadines is probably going to remain fairly strong until people's lives are impacted directly, or your pockets. The entertainment sector, we were impacted directly, but we are a very small section of the population. But when I came home, people were going into Kingston, shopping like normal. People were hanging out at bars, no mask. It was normal. You couldn't, if you were from Mars and your alien ship stepped onto St. Vincent and the Grenadines, you wouldn't know that there was a COVID-19 pandemic. And I'm being very honest because I had not been in the country for a while. And I said, but what is this at all? Everybody's living normal. So if you're normal and if you get and you're realizing I'm okay, this thing not touching me, why should I become vaccinated? So that for me is the main resistant point that I'm not sure we are probably ever going to overcome. because we're so blessed that the infection rates have not led to significant death rates and so on. Whether or not that will continue, perhaps not, perhaps yes. But Dr. Denny made a very valid point. Because we are small as well, it means that we stand to benefit from everybody else's protection around us. And so I'm not sure we might ever get past the resistance point, but we might be lucky enough to actually be able to go back to normalcy. But that's luck. It is no guarantee. And I would rather have a guarantee. So I would say the work of those who are involved in the promotion of vaccines should continue. The persons who have been vaccinated should continue to encourage others, because vaccines work and because we still have to think of this not as individuals, but as a society as a whole.
Yeah, our luck rested on two things. Our luck rested on geography and chronology. That when the pandemic began, it began in China, and then it traveled, to Europe, to the US, etc. And it took about a year before the pandemic truly arrived in St. Vincent. So that's chronology. And that geography helped to delay the reach of the virus. The virus has to travel from one place to another. Someone has to take it. And that time allowed the rest of the world to shut down, providing a kind of cocoon to St. Vincent, from which we benefited. Now, the irony is that our luck actually increased after that, because viruses replicate, and when they replicate, they mutate. When the mutated virus actually arrived in St. Vincent, it arrived at the time when we already have vaccines. So the Delta virus, the Delta variant, which is quite traumatic in what it has done to the US and Europe and so on, it arrived in St. Vincent somewhat late, and by then St. Vincent already had the opportunity to use vaccines. Okay. By the time Delta is on its way out, as Dr. Keyser noted, and Omicron has entered, Omicron is obviously nothing to sneeze at. You can't, as our earlier panelists mentioned, invite Omicron into your body. You don't know that it's going to be Omicron, and you don't know that whether it's going to kill you or not. And if it doesn't kill you, you might actually kill someone else. But even so, it is, in the broadest numbers, it is true that it is less severe than Delta. So there have been many elements, and that is pure randomness as to how a vaccine mutates, whether it's be less severe, more severe. That's utterly random. We have no control over that, but we have been the beneficiaries. Okay, and so having been the beneficiaries of these, interventions, really, and combined with a pretty aggressive assault against science, against the responsible government, and where there are powerful organizations like the unions, who, in the name of fighting vaccine mandates, have at times fought against the scientific truth of the vaccines themselves, and so that you couldn't even distinguish, are you fighting mandates or are you actually fighting the truths of the vaccines? And so we have had powerful bodies in St. Vincent which have been anti-vaccine, and simultaneously we have had a set of fortuitous circumstances which have limited the price which we've had to pay. Okay, and so in that sense, it has hardened the resistance, making St. Vincent among the worst. But then again, I do take the point, we are small, and the gravitational pull of the world around us can't be forever resisted. And as the world transformed, so would we.
If I could just jump in here really quickly as well. I remember when we started, because February 14th this year is actually going to be a year since we actually officially started to give the COVID-19 vaccine. I remember last year when we started, the response was very overwhelming with just the very small doses that we had in country. And I remember saying to Dr. Pisa and the rest of the team, we got this by, August, we're going to have 60-70% vaccinated. We're going. I remember very clearly the first time I went to the Southern Grenadines, to Union, kind of, and I'm like, I'm coming back with 200 max. And I was so excited because we had all the information, we had all the resources, we had the tokens, we had so many things available. But at the same time, the Vincentian population is very unique, and we learned that. And even coming out of the UNICEF survey, it was not a surprise for us in the Ministry of Health, because we had done a survey earlier with PAHO with another consultant who actually highlighted a lot of that, and a lot of it has not changed actually. And Shafia also pointed out we welcomed their support last year, and we really appreciated the effort from the entertainment sectors to sort of drive and push and give our vaccination campaign that boost. But like she also said, the whole personal benefit associated with getting vaccinated. I have no intention of traveling, but I want you to make sure those people coming in vaccinated and tested, and they must quarantine and they must stay away from me, but allow me in country to do whatever I feel like, quote unquote. And so that is something that we definitely have to continue with. It's not an end, because it's a new year. We still have to try to get as much persons vaccinated as much as possible. But in terms of the hesitancy, it's very unique and different to St. Vincent with other countries, because if you look at the survey and you compare with other countries, you would see that there is a significant difference where the Vincentian population is concerned. Dr. Kiza?
No, I think, no, you're right, Shanika. I mean, we had everything. We had vaccines before a lot of other islands had vaccines. We have had sufficient vaccines in St. Vincent to vaccinate the population more than once, fully, So, and we have been out there. We currently have Pfizer. We got 70,000 doses of Pfizer in December. So we have sufficient Pfizer to vaccinate, again, 35,000 persons, to give sufficient boosters. We have AstraZeneca, we have Sputnik, we have the Abdala, we have a wide range of vaccines. We have gone to persons all over the island. We are available. Right now, we are having some challenges because we have a spike now. And so the same staff we use to vaccinate persons, now we have to use those persons to test and treat and manage. The hesitancy is not been a surprise. As we said, we have this survey, the survey we did in June, July, and the survey that the entertainers did, and then this survey again. The same thing is continuing. This is why we recognize that. So, for example, if I said something, persons, as soon as I open my mouth, there are a lot of persons out there who would say it's a lie, right? So we recognize that, and we recognize that we needed to have other voices, and we recognize that you needed to have persons of a particular, target groups, persons speaking the language of the group. And so that's why we welcome the entertainers, and we would welcome, the church. And I personally feel that none of these studies, however, have identified the level of importance and influence that the church has in St. Vincent and in terms of the resistance. I think that is understated. I don't think that is represented fully. But we will continue to work. We will continue to try to do small groups as safely as possible. And the UNICEF study also identified that there's a resistant group that even became more resistant, more hesitant over time. And so we have to decide which group we're going to focus on and how we're going to focus in on that group, because as was said, it's a very expensive campaign to run, but we have to look at the end, because what's the value of a life and a livelihood? And when the breadwinner is at home sick, who feeds that family? When a child is away from school, those are long-term effects. So that It is expensive, but we are determined to continue and to work with the partners necessary so that we can get this one done. Yeah.
We have another question. What about taking the Cuban one as a booster? Also, what are the chances of traveling to the USA and some Caribbean countries with the Sputnik and the Cuban vaccine?
Okay, so I'll answer that one. The Cuban vaccine we got is the Abdala, and it's a 3-dose vaccine. And so we only got 100, sufficient for 100 persons. We got 300 doses. So we are seeking to procure some more. So we're not going to be using the Abdala as a booster because we only have sufficient to give 100 persons a complete dose of 3. Okay, so we won't be using that as a booster. In terms of the traveling, still the Sputnik, which I took and I'm convinced it is one of the best vaccines, has not been approved by the WHO. If you check the WHO website, they will say that they're still pending the submission of more information from the makers of the Sputnik vaccine. And so besides Guyana, Barbados, and some South American and Central American countries, and of course, well, Russia, they are it's not recognized. The same thing with the Cuban vaccine. So the US has not recognized the Sputnik or the Cuban vaccine. The UK has not, and some of our other CARICOM member states have not recognized those vaccines. So that is a challenge. If you plan to travel to any of those countries, you're going to have to take another, whether it's the Pfizer or the AstraZeneca, or we should get some Moderna later on, probably next month, and something like that. But you cannot travel to the US if you are only vaccinated with the Sputnik or the Abdala, which is a pity because these are very good vaccines.
Well, I was seeing question. Okay, we have another one. If you have serious side effects like constant bleeding during periods, an accelerated heartbeat, and an enlarged heart after taking the vaccine, would you still encourage that person to take the booster, bearing in mind that you had none of those problems before the vaccine?
Okay, so let me take that again. So that person should see their doctor. Okay. There's research coming out which confirms that there have been persons who, after the vaccine, had a short change in their menstrual cycle. So some persons missed the period, some persons had a heavier period. But in all of the research coming out, that was just a transient thing, meaning it didn't last long. If you are having a period that's so heavy, and that you're now having an enlarged heart and you're having palpitations and racing of the heart, you definitely need to see your doctor. And in a situation like that, that doctor would advise whether or not you should take a booster, but you need to get that acute situation of bleeding, a large heart, and racing of the heart, determine exactly what is causing it, and deal with that, and then be advised as to whether or not you need the booster. Bearing in mind that if you have heart disease, you are at higher risk for a bad COVID infection and bad outcome. So we need to weigh the benefits and the risk between not taking it and taking it. And a lot of that would have to do with a specific diagnosis as to why you have heavy periods, racing heart, and an enlarged heart. So you need to see your doctor and be advised on that.
Another question, should there be a medical done for patients who have recurrent blood clotting problem, or should they be exempted?
Okay, so the blood clotting issue was related to the AstraZeneca, and the frequency, the incidence of blood clots after AstraZeneca vaccine is much lower than the frequency of blood clots after using the pill, and many of the other things we frequently do. The Pfizer was not associated with blood clots, and so therefore Vincentians again are very privileged. If you have a history of blood clots, and that has been investigated as to the cause of the blood clots, the recommendation is that you take a Pfizer instead of the AstraZeneca vaccine. Okay?
Thank you. Are there any more questions for us tonight? I was seeing some questions about the side effects, and I don't know if Dr. Kiza would like to speak about that, the side effects of taking the vaccine.
Vaccines.
Yes.
I seen somebody making a comment there about
Yes, the
prior
CDC
infection.
finds prior infection provided strong protection against COVID, even stronger than being vaccinated.
So I'll be interested to see the specific study because, different studies, you can read, you can have certain conclusions or certain things can be stated. However, even if we look at what has happened here in St. Vincent, we had persons who had COVID in October and they have COVID again now. So you can have some individuals who might mount immunity from an infection, which is going to last them 6 months. And you would have another individual who would not be able to mount that natural immunity. And within a month, they are infected again. The vaccines provide the most consistent level of immunity. And that is what we are dealing with. We cannot afford to say, okay, well, you might have some immunity and you mightn't, so we will go with that might. We can't do that. That is not how we can get out of this in a safe way. So the vaccines provide the only, at this point, consistent way of saying that we would have some immunity. So even as you have you've had COVID, you're going to be recommended that you should still have your vaccine after, or you should still have your booster, so that you have the maximum amount of immunity going forward to deal with whatever we're dealing with. Shana, what was the question again? I
No, it was about.
If I may step in there quickly,
Sure.
that person didn't properly report what the CDC has said. The actual report says that someone who has been infected and who has also been vaccinated. So both things have happened. The person has been infected and the person has been vaccinated. Those persons have shown a strong, resistance towards the Omicron when measured against someone who has been just vaccinated but not infected and vaccinated. So it's a very special kind of category. And the CDC also said that there are several caveats, that it does not include in that study persons who have been boosted. And so you cannot take that claim as to anything other than a peculiarity that the CDC has discovered, because the particular category does involve people who are both infected and vaccinated. Okay, so you got to be vaccinated to get that effect anyway. And of course, to be infected is a risk, a terrible risk, because you just might die. We have 5 million who testify to that.
Oh, well, okay. Are you allowed to take the booster before the 4 to 5 month time frame?
At this point, the evidence is saying that is not necessary. Okay, that's not necessary for you to take it before the 4 to 5 month period as your first booster. There's research that has come out that says, and Shanika, I know Shanika doesn't like me to say this one, but this is science, and you're dealing with evidence, and you have to use the evidence to warn and to protect you and to your benefit. So as Dr. Dennis says, we were lucky in that things are happening around us, and by looking at what's happening around us, we can be better prepared. So the research coming out of the UK says that after your booster, which you have taken 5 months after the initial, that booster also then will have to be, you will have to have another booster after that. it's very likely because your immunity wanes again. Some people might say, oh my Lord, why are we going to, so we will never end this cycle of boostering. But think about what happens when you take your children for a vaccination. You take them for one shot, and then nurse gives you a little card and says, you have to come back again in how many months or how many weeks. Or if you have a tetanus vaccine, you remember you had your tetanus shots as a child, you had a booster when you went into secondary school at 11, but that booster lasts for 10 years. And you might say, okay, well, that's 10 years. But this is an evolving virus. It is not a stable organism like the tetanus or so. And so we have to be making adjustments as we go along. So short answer there, no, not as yet, not under 4 to 5 months.
No, okay. I saw a question earlier that asked if the long COVID, you get long COVID from all the variants of COVID, or is it just one specific variant of COVID-19?
So far, it's all the variants that we know of. But remember, the Omicron was detected, only detected in November. You know, remember when COVID started, by doing studies, they realized that it had been circulating for a good while before they actually detected it. But for now, Omicron is from November. And so the information as to when long COVID, if it will develop from Omicron, is not, there's not sufficient data on that as yet. But because of what long COVID is, where information is now coming out that long COVID is an excessive immune response to the virus, and Omicron is a variant of this virus, it is highly likely that you would have long COVID coming out of Omicron also. But as far as I know, Dr. Denny, Shanika, Shafi, I'm not sure if anybody else has any more up-to-date information on long COVID and Omicron.
Well, what some of the research has shown in terms of the people who they have died, unfortunately, and they have, done the pathological work on these bodies. COVID infects every single organ of the body. That's the frightening, element of why we have long COVID. That though for the most of the people who have died, it's because of distress in the lungs, etc. Some have died from other kinds of manifestations of illness. But in terms of the work done on those who have died to see, okay, what's going on? What is this virus doing? It affects every organ of the body, and hence those who have survived, the illness then manifests itself for a longer time, in myriad ways. And so that's the problem. So you could reasonably expect that the Omicron would do the same thing. Fortunately, less people are dying from it, but the virus really does affect, invade, multiple organs of the body.
Thank you so much to our panelists. We have run out of time, but we will take a final comment from each of our panelists. Dr. Denny, would you like to lead the final discussion?
Well, I think that we are likely to move out from a pandemic into an endemic kind of phase. And by that, I mean we would be able to live with the virus. We'll have therapies that would be effective. We'll have testing, speedier testing that can identify those who are ill. And we'll have broader use of the vaccines. It's simply a matter of time. The timing we cannot predict with any degree of certainty, because the virus has demonstrated the capacity to mutate. We have had Delta, we have had Alpha, we had Beta, now we have Omicron. We cannot say with any level of certainty what the next variant might be. But what is also possible is that through mass vaccination, and through therapeutic intervention, through discipline in masking, washing our hands, doing all of these things, if we retain the simplicity of what should be done and be disciplined about doing it, we probably can come out of this pandemic in 1 to 2 years.
Miss London, would you like to give final comments?
Yes, certainly. So I just want to say that we need to continue to our efforts. We need to get back to a sense of normalcy, and I'm hoping that that will be very soon, because people's lives are being impacted in more ways than one, and it might not be your own, but it might be somebody close to you. But we also, as a country, we need to be very careful about disinformation. There is a lot of propaganda. There is a lot of false information that is spreading to deliberately deceive people and to confuse the correct information. And it's deliberate, and it's also very strong. A lot of persons are involved in that. And unfortunately, it has caused a lot of confusion. It has caused a lot of hesitancy. And I'm hoping that in the small corners that we have established to help the Ministry of Health, to help the authorities to send the right message, to send the right information, that we can have some influence. But those corners right now are small. So I think Dr. Keyser said it. The churches, the different community groups need to get on board to ensure that people are getting the right information. I see people post a lot of statistics, and when you check the source, just the website alone from which it comes would tell you this can't be accurate information, just the name of it alone. And we don't even check that. We just read it and say, I have evidence to prove that vaccines don't work. And these organizations, they're organizations that have been around for a long time. I'm not saying they're perfect. And unfortunately, scientists have not done a very good job with communication. Therefore, scientists are far behind those who are deliberately sending the disinformation. But we all have a individual and a collective responsibility to help society to get back to normal. So yes, eat right, keep your immunity boosted naturally as well. But science has also shown that the vaccinations work, and therefore we want to continue to encourage persons to become vaccinated.
Miss John, final comments?
So I also want to take this opportunity to remind Vincentians and those listening as well that we still have to take all precautionary measures. And this is a very evolving situation, and we're going to have to adjust very quickly. And so from the Ministry of Health, what we say today might not hold next week. And it's our responsibility to try to adjust and adapt and update the public accordingly. And so it is also the responsibility of the public and those who may need to have that information to do the same. So I want to point that out there, because sometimes people say, well, last week they said this, but this week they're saying this, and so forth. It's a constant running pace for us in the ministry, particularly. So we will try our best to update. And in the meantime, you need to do what is best for you, for your family, for your children, for your grandchildren, and for the wider society.
Thank you very much, Dr. Keyser Beach.
So I want to thank you for this opportunity, because of the importance of the press, the media, in terms of doing their best and their being responsible in this fight. Too often, I think the focus of some media houses is to shock, or they have their own other agenda going on, and they are not as careful or as strict in terms of the information or the headlines that they use. And we have to understand that we are all in this thing together. And if somebody has their own little their agenda here, just as I said, for those persons who say, okay, let me get the Omicron, but you don't know if you're going to get Delta, right? And you don't know if what you said there as a media person and the impression you gave is going to affect X and not yourself or close to who. We all have a responsibility. And as I was saying to Shanika, the Ministry of Health says your health is a shared responsibility. And the Ministry of Health is committed We will continue to work with you. But if the individuals do not take up their sense and take on their responsibility to make themselves healthy, we will be battling this for much longer than everybody else around us. And we plead with you, we're going to really work. We're not going to give up, but we know that a lot of it must be, just as, with the diabetes and the hypertension, you have to do your part for us to get out of this. So I want to thank you very much for this opportunity.
Thank you very much. Thank you to our guests and to everyone who joined us this evening. See you next week in the press room, same time, same place. Have a good night.
Bye-bye.